If you or your partner snore, here's the hard truth. Snoring isn't just a noise problem. For many people, it's an airway problem. Tonight, I'll show you how to run a simple self-check and then follow a 7-day plan to quiet the snore, sleep deeper, and wake up clear-headed using practical steps you can start today. I'm not here to shame anyone. I'm here to help you breathe better at night. By the end of this video, you'll know what snoring actually is, when it crosses the line into sleep apnea, and exactly what to do over the next 7 days to get results safely. First, what is snoring? When you fall asleep, the muscles of the tongue and soft palate relax. If the airway narrows, the rushing air vibrates those tissues, exactly like wind buzzing a loose window screen. The narrower the airway, the louder the sound. Add alcohol, a stuffy nose, sleeping flat on your back, or extra tissue around the neck, and the vibration gets worse. Why should you care? Because a narrow, floppy airway can periodically collapse. That's when snoring breaks into silence, no airflow, followed by a gasp. Those pauses are called apneas. Repeated drops in oxygen and micro-arousals fragment sleep, raise blood pressure, stress the heart, and wreck next day focus and mood. So yes, reducing snoring isn't just courteous. It's cardiovascular hygiene. Quick self-check. If most nights you snore loudly, wake unrefreshed, doze off watching TV, or your partner notices pauses in breathing, your risk for sleep apnea is higher. Other clues: morning headaches, dry mouth, high blood pressure, or a thick neck. None of these proves apnea by itself, but together they say, take this seriously and consider medical evaluation. If you already have significant heart or lung disease, if you're pregnant, or if anyone has witnessed long pauses in your breathing, do not wait. Talk to your clinician. Now let's build your 7-day airway reset. This plan won't replace medical care, and it won't treat moderate to severe sleep apnea the way a CPAP or a custom dental device can. But for many snorers and for people with milder symptoms, it can quiet the nights and improve energy fast. Day 1. Set your baseline and prep your bedroom. Tonight, record your sleep with your phone's voice memo or a snore app on the nightstand. Ask your partner to note any pauses. Take a neck-up selfie while sitting and gently stick out your tongue. If your tongue covers most of the back of the throat, that's one reason you snore. Don't worry, we'll train it. Now fix the easy wins. Make the room cool, dark, and quiet. Elevate the head of the bed a few inches or use a wedge pillow. Put a tennis ball or a rolled towel in a pocket on the back of a t-shirt to discourage back sleeping. And set your consistent sleep and wake times for the whole week. Day 2, open the nose. A blocked nose forces mouth breathing, which collapses the airway. 2 hours before bed, do a gentle saline rinse in the shower. If you have allergies, talk with your clinician about a steroid nasal spray. It often reduces swell and snoring. At bedtime, try adhesive nasal dilator strips or a soft external dilator. Simple, low-risk aids that help many people. Run a HEPA filter if you share your room with pets or pollen. Day 3, alcohol and meals. Pull the brakes. For 1 week, avoid alcohol within 4 hours of bed and skip sedatives unless your prescriber says otherwise. Both relax the throat and make snoring worse. Eat dinner earlier and lighter. Avoid heavy, spicy, or high-fat meals late. If reflux bothers you, elevate the head of your bed and don't lie down within 3 hours of eating. Day 4, teach the airway to stay open. Now we add oropharyngeal exercises, 5 minutes twice a day. These are simple muscle training drills for the tongue and soft palate that research shows can reduce snoring and mild apnea. Try this mini routine. Tongue slides. Press the tip of the tongue to the ridge behind your top teeth and slowly slide it back along the palate. Repeat 10 times. E-ah-oo, exaggerations. Open wide and say each sound with big, slow movements to engage the soft palate and side walls. 10 cycles. Cheek push. Press your tongue into the inside of one cheek while resisting with a finger on the outside. Hold 5 seconds. 5 reps each side. Balloon breaths or straw blows. Controlled exhale to strengthen the soft palate. 3 slow inflations, or 10 straw blows. These feel silly. Do them anyway. Strengthening these small muscles adds real millimeters of space where it matters. Day 5. Train the position you sleep in. Back sleeping is the friend of snoring. Side sleeping is the fix. Keep using the tennis ball shirt or try a comfortable positional belt. If you must sleep on your back because of pain, elevate the torso 20 to 30 degrees and use a supportive pillow to prevent the chin from dropping toward the chest. Check your pillow height. Too flat lets the jaw fall open. Too high kinks the neck. Day 6. Evening wind down and nasal calm. The hour before bed is sacred. Dim lights, no doom scrolling. Do a 5-minute breathing routine, 4 seconds in, 6 seconds out to lower arousal. If congestion creeps back, use your saline rinse again, then your nasal strip. Gentle jaw relaxation helps too. Lips closed, tongue resting on the palate, teeth slightly apart. This is the mewing rest posture that supports a quiet airway without clenching. Day 7. Review, measure, and choose your next step. Compare tonight's snore recording with day 1. Are the gaps shorter? Are you less groggy, fewer headaches, better mood? If yes, keep going another 3 weeks. Muscles adapt with practice. If you're still snoring loudly, waking gasping, or falling asleep during the day, it's time to escalate. Speak with your clinician about a sleep study. Many people do best with a custom mandibular advancement device from a dentist or with CPAP therapy. Those tools save lives. There's no shame in using them. Let's layer in some long game upgrades that compound your results. Move your body every day. Even a brisk 20-minute walk after dinner improves glucose handling and reduces nighttime airway swelling. Aim to lose 5 to 10% of body weight if you're carrying extra. Even modest loss can shrink tissue around the throat. Keep alcohol and sedatives out of your last 4 hours whenever possible. Work on nasal health. Treat allergies, dust often, wash bedding hot weekly. Keep the same sleep schedule 7 days a week. When to seek care urgently. Witnessed long breathing pauses, waking choking, morning chest pain, very high blood pressure, repeated oxygen alerts below the 90s if you wear a pulse ox device, or daytime sleepiness so strong you could doze while driving. Please don't ignore these. I'll close with this. Snoring is common, but it's not normal. Your airway is trainable. Your habits matter, and you don't have to fix everything at once. Start with the nose, the position, and the short daily exercises. Give it 7 days. Most people notice a difference. Many partners do too. This video is educational and not a diagnosis or a treatment plan. If you have concerns, especially if someone has seen you stop breathing at night, see your clinician or sleep specialist. If this helped, subscribe to Vital Proof. In the comments, tell me which of the 7 days made the biggest difference for you and what you want covered next. Sleep quietly, breathe easily. See you next week.